all her insight on impact and how to communicate impact and measure impact. But thank you all so much for joining us today. It's really fabulous to see such a large number of people register interest in the Spotlight series, and it's a real credit to Annalise, who has spearheaded these Spotlight series for us. So before we start today, I do just want to take a moment to acknowledge that I'm meeting on the land of the Kaurna people here and recognise their cultural, spiritual, physical and emotional connection with this land. I'd like to honour and pay my respect to Kaurna elders, both past, present and all generations of Kaurna people now and into the future. And I'm also aware that many of you might be meeting on other lands, so we just want to acknowledge that as well this morning, or we might even be this afternoon now. Look, today we're really stoked to have Dr Tamika Heiden with us today from the Research Impact Academy. And I think impact is a topic that's dear to all of our hearts, whether it's because we want to achieve impact or we need to demonstrate it for the grants, or both of the above. It'll be great to hear from her shortly. So before we start though, my name's Ecushla and I'm a program manager here at HTSA, and I think I'm filling in for Wendy Keach, our CEO, this morning. And it's fabulous to have you all here. This is the first of a 4-part series we've got going throughout March and April on impact. So it would be fabulous if you can tune into all of these. Next Monday, we have a session on evaluating impact and developing a framework, which is a great follow-on from what Tamika will be sharing today. We've got some insights from the NHMRC on the 4th of April, also extremely valuable. And on Friday, we're going to actually showcase some impactful projects, why they've been impactful, and we're also going to give out our HTSA Research Impact Awards. So it would be great to have you on board for that as well. If you want any more details about the webinars that we have, just jump onto our website, into the Spotlight series, or follow us on LinkedIn and Twitter and everywhere else that you can find us. So before we have Tamika speak, I just wanted to spend a couple of minutes for those of you who may not be aware of who we are. So Health Translation SA is actually one of the NHMRC accredited translation centres. I think there's around 10 around Australia, and in South Australia we are a statewide translation centre. And you can see in the bottom here that we actually have 11 active partners, which is terrific, and it really enables us to do things that are relevant to all South Australians. So the reason HTSA exists is to help accelerate the translation of research into practice. So this is both healthcare practice as well as policy changes, and we're also about increasing that whole of state system capacity to translate research into impact. And that really means making sure that we can see research embedded in the health system and working in lockstep with the health system and informing it. So at HTSA, everything we do is about collaboration and partnership, and this is the way we work. We really are an independent catalyst in SA, and we act as a broker to help mobilise the leadership collaborations that can help address some of the major issues that we have in health in the state. So really, we work really hard actually to bring together our university sectors, our research groups and institutes, the health services, policymakers, our consumers and community, as well as other key stakeholders, not-for-profits in the health sector and industry. So partnership is definitely at the heart of everything we do. And I think you'll find that that's probably a key theme that comes across today in trying to achieve research impact. If you do want to know any more about HTSA, you can jump on our website. We have just released, well, 6 months ago now, our strategy for the next 3 years. And I guess all I want to highlight here is that we're really operating in 4 major spaces. We're about bringing the right people together to make sure that we can do what is needed and build off the strengths of each other to make a difference. It's about getting the right projects done, so the things that make a tangible difference to people in the state. We're about celebrating and showcasing impact. So our fourth spotlight for this series will actually celebrate and showcase some of the great high impact projects that are on the go, and also about building the environment that enables us all to achieve impact. And really today is about that. It's about helping raise awareness of what impact is and helping build that environment that enables us all to achieve success and achieve the impact that we are desiring to achieve. So I guess before Tamika comes on board, in thinking about impact, there's a number of things that we've just found are absolutely key. And when you're looking at people's grant applications or projects that are really successful or really make that tangible difference, there's a few things that are really common to all of them. And I guess it's important to just say straight up that obviously achieving impact is a dynamic and iterative process. It probably, it evolves over time. It rarely goes the way that you think it's going to go. But it is this dynamic journey that we are all on. And I think the main features of achieving impact and having a research paradigm that enables you to achieve impact is really the following. It's to understand the problem. We're not just solving something that we think is interesting necessarily, but really understanding what's the problem that sits behind this. Who is it a problem for? How big is the problem? And actually, how much of a difference will it make if we address this problem, and who will it make a difference for? And then once we've answered those questions, we can then have a look at, okay, so what's the knowledge base? What is the evidence that we've got that we can bring to bear upon this problem? Or what is the gap that we need to fill in being able to address this? And then from there, we have the good foundation to be able to engage all the stakeholders that are relevant to this. And communication is a critical skill here. Stakeholders for us, it's critical that in thinking about how we achieve impact, we stop at the start and we say, okay, not only who will this impact ultimately, which will be ourselves and other people that make use of a health system, but all the other people along the way. Is it the nurses? Is it the allied health staff? Is it the admin staff in the hospital? Is it the primary care? And making sure that we get all of those people engaged in whatever way is meaningful for them to contribute to the success of the project. And then, of course, there's actually understanding the context that we're sitting in and all the barriers and enablers that may be there as we head towards trying to achieve impact, and really making sure that we think about not only achieving impact at the start, but how on earth are we going to know if we have achieved impact? How are we going to evaluate this along the way so that we can demonstrate impact, which is clearly a requirement for most of the grants that you'll apply for. So I guess for me, achieving impact, I think what I have actually learned over the last few years, it's actually a mindset thing. Achieving impact is a paradigm that successful researchers adopt and they sit in. So although, we have a whole series of activities we do to try and achieve impact and ultimately see that embedded in a sustainable way in the health system and scaled up more broadly, it's actually about right at the start having that mindset that says, what is the impact that I'm trying to achieve? Who am I trying to achieve this for? And who do I need to bring along this journey with me in order to achieve impact? So as I go to hand over to Tamika this morning, I just want to leave these two questions with you. And hopefully it's something that, many of you are already doing. But if you're just starting out on your research journey or just working out what translational impact is, it's great to stop at the start and consider, what is the ultimate problem I'm trying to address? Who is the next user of my research, as well as who is the end user? And is there a way that I can get all those people involved throughout the journey of my research in order to achieve impact? So that's enough from me. I think that's more than enough from me. It is my great pleasure this morning or this afternoon to introduce Dr. Tamika Heiden, who is from the Research Impact Academy. Tamika, I'm just going to read your bio, Tamika, for a second. Tamika is the principal and founder of the Research Impact Academy, which was formerly known as Knowledge Translation Australia, and she has a background in health research and research coordination. She is absolutely passionate about making impact easier for research and research organisations, and I think that's something that you're going to clearly see as she starts communicating and telling us all about impact today. Her goal and purpose as the principal of the Research Impact Academy is to ensure that research is relevant and accessible to the people who need it. She has well-developed networks nationally and internationally and has trained widely, probably wildly as well, in the field of research impact. We've worked with Tamika a bit over the years, and it's always been a great pleasure to attend her impact seminars, and I'd encourage you to do so if you get the opportunity. And she has some great tips on how to think about impact and how to measure impact. So I'll just stop my screen share, Tamika, so that you can log on. But welcome, Tamika, and thank you so much for making your time available today. Are you all good to go at your end?
Yeah, great to go at my end. Thank you. And yes, wildly, of course. Yes, always wildly. For those of you who do know me, will probably agree with that comment anyway. So I'm going to share my screen and we'll jump into it. Thanks for the introduction, and lovely to be here and to see a lot of people here. Some I've met before, some I haven't, which is fantastic. Hopefully you can all see that. All good, Ecushla?
Yep.
Great. Okay, so we're going to jump into kind of an overview of what impact is. And again, those of you who know me know that I could talk about this all day, but I want to make sure that we have time at the end so that you can ask questions and get what you need out of this session. So that's just my details there for anyone who wants to, tweet or whatever. That's go for that. I always like to talk about impact as having these two parts. When I started off, as the introduction said, I started off under the banner of Knowledge Translation Australia, and my passion is knowledge translation. But what I found was that people didn't understand the connection between translation and impact. And it sounds like most of you here kind of get that, and it's what the centre's about, which is fantastic. So I always like to start with those two parts because we tend to jump to the end and say, what's our impact been, without thinking about the journey to get there. And both pieces are very important. So what are these two parts to impact? Well, the first part is the translation piece. It's the what I call knowledge translation. It's that pathway. It can be called research translation and other things as well, but I call it knowledge translation, and I'll explain why in just a moment. But it's the pathway to impact. Then we have impact, which is what happened because of our translation. So you've got the knowledge translation of how did we create impact? So that's the creation piece. And then we have what happened because of the translation I did. So when we're translating our work, we're putting it into different formats, we're changing it for different audiences, and then we're measuring or assessing the impact. What happened because we shared our information to that audience or because we worked with that group. So an overarching kind of definition for this is to outline what it is and to give you that kind of picture of how it's that translation to how it's that pathway to impact. This definition comes from the World Health Organization, who put this definition together in 2005. They kind of stole it from the Canadian Institutes of Health Research definition in 2000 and took the word Canadian out. But the language in here is really valuable to people. So synthesis, exchange, application, really, really rich language, relevant stakeholders, accelerating benefits, innovation, strengthening health systems, improving people's health. And in fact, you don't even have to be in health to use this definition. You just take health out and put in whatever the problem is that you're addressing. So as Ecushla said in the introduction, it's knowing what your problem is and how to address that as well. So it's this pathway to impact. What I want to talk about now is really, as I said to you, I like that term knowledge translation. And the reason I like that, just to give you a bit of a picture here, is because what I've found with research translation is we kind of think about, okay, I'm going to do this research and then I'm going to push it out into the world, or I'm going to give it to someone, or it's going to change something. But there's a whole complexity around how that happens. And so we have to understand that the solutions that we're providing involve a combination of knowledge from diverse stakeholders. So to get to solutions, we not only need research knowledge that comes from researchers, we also need to think about what's the practice knowledge from practitioners, and what's the experiential knowledge from people with lived experience or parents, communities. What's the organizational knowledge from the service system? So what's the decision-making process? What are the bureaucracies involved? What's important to organizations right now? And what's the policy knowledge that can feed into this solution? What do policymakers care about? What's the timing? When's the best way to give this to people? What's the format it should be in? So all of these pieces, when we can take knowledge from lots of different groups, including our research knowledge, and mold that together, we come up with solutions. So it really does speak to that partnership piece that was in the introduction there again as well. And so speaking the same language, probably just using a few different words. So what is impact then? And, you know, luckily for us in Australia, we not only have one definition, but two different definitions. It took us a long time to get one. I lobbied, and then we ended up with two different ones, which isn't helpful. Anyway, the ARC's definition is that research impact is a contribution to economy, society, environment, or culture. Importantly, in their definition, it's beyond the contribution to academic research. So what's happening outside of the academy? What's going on in policy, society, environment, etc. Now, that particular definition comes from the engagement and impact assessment done nationally. The next one's in 2024. And so for that assessment, they're very interested in how is research being used outside of academia. The other definition you may be familiar with in the health area is the NHMRC definition. I actually quite like this definition. I love that it includes knowledge. So verifiable outcomes that research makes to knowledge, health, the economy, and or society. And importantly, it's the effect of the research after it's been adopted, adapted for use, or used to inform further research. So knowledge impact is right in there. If you're having an impact on further research, on science, on the discipline, that counts in an NHMRC world. But what does impact really mean? And as I said, I really like the NHMRC's definition. And the reason I like it is because it tells you how to do it. So they say it's the effect of the research after. Now that's the core, after it has been adopted, adapted for use, or used to inform further research. So those words, adopted, adapted, and used, are the core words for impact. So keep that in mind as you're thinking about this. It's not what you found in your research, it's what happened after you found that information, after you came up with that new process, protocol, evidence, whatever it is that you find from your work. What happened after that? Who adopted it? Who adapted it? And who used it? So again, across the NHMRC, ARC landscape here in Australia, we have some different types of impact. As I said, NHMRC has this knowledge impact, so that's in their particular definition, and the other types sort of sit across different areas of impact. So knowledge impact is that adoption, adaptation, or use of your knowledge for further research. So that can be basic and fundamental concepts that are being taken up. I've got some examples of this at the end, so I'll give you a few more kind of tangible things to take away. Health impacts can be new therapeutics or diagnostics, disease prevention, health policy or health system changes. Economic is obviously going to be economic, so jobs, industries, commercial outcomes, something that our government really loves right now. Social impacts, so improvements in society, inclusion, access to information or access to services. Environment, so environmental outcomes that can be around the health of the environment, sustainability, and cultural impacts. So these are around people's beliefs, attitudes, the discourse, behaviour, and those other areas of cultural impact. A couple of other terms that I just want to share with you and kind of expand on a little bit. They do come out of the NHMRC guidelines, but they are used globally in impact. We talk about reach and significance in impact quite globally. So significance is the degree to which the impact has enabled, enriched, influenced, informed, or changed the performance of policies, practices, products. So it's what was the degree of change? What happened? What was the thing that changed because someone used, adopted, or adapted your knowledge? And then you have reach, and reach often gets confused with impact. So it's really important to understand what reach is. So that's the spread, the breadth, the extent, or the diversity of beneficiaries. Reach is often numbers. So it can be the number of people downloading a journal article, for example, might be reach, or the numbers of people attending an event, or the numbers of countries coming and accessing a website or using your papers or your new tool. So that can be reach. Often with reach though, we know the numbers of people downloading something, for example, but we don't know whether or not they've used that information, and we don't know if, because they use the information, anything changed. So we need both. We need to know who's using our information and what's the significance of that use, but also how many people or what groups is that information reaching? So we need both reach and significance, and they don't get separated out, they go together. So use of my work has reached however many people, as an example. I see a lot of people get really confused, and particularly if you're in the NHMRC realm, which is very fresh in my mind because it's closing, I believe, this week. But if you're in that realm and you've been looking at investigator grants, people kind of go, I've got to write about my significance, and then I've got to write about my reach. They go together. So please keep that in mind. You know, you're going to talk about the significance and reach together, because otherwise you're going to repeat yourself. My very good colleague and mentor, David Phipps, says this, and it's a saying that I really love, and that is that impact is measured at the level of the user. So when you're thinking about impact, and you've heard me already saying it a lot, you're going to be saying, who used my work? That is the number one thing, the use of your work. It's the number one term we always use. So whenever you think about impact, ask yourself, who has used or adopted or adapted my work? Now I'm going to walk you through the logic model that we use at the Academy. We use it with everyone. Some of you will have seen it before. It's a good refresher for those who've seen it before anyway, but it's the number one way to think about and get impact out of your head. A couple of things. Logic models look linear. We know it's not a linear process. I get it's messy. There's a lot of other stuff that goes on, but my goal is to simplify it for you to make sure you can get it out in a way that makes sense and think about it. So I'm going to walk you through our model of our logic model of impact. We worked with a lot of researchers on a typical model of impact and found that there was a piece missing. It was really hard for people to kind of work out what was going on. There was a bit of magic happens in the logic model. So we changed it up to help people understand what is it we mean and how do you get from an output to an outcome. So this is our logic model, and typically a logic model will have inputs, it'll have activities, outputs, it'll have outcomes and impact. And what we've done is made this much more of a translational type of model, if you like. So that purple column that traditionally would be inputs is that co-creation of that relevant research. So working with those users, understanding what that research looks like from both perspectives. So bringing in all those different knowledge holders that we talked about for those solutions. So working with them, undertaking that market research, what's needed, what's valuable, what's happening right now, and how does my work align with that? Building those collaborations and those partnerships with different users and going out there and having those conversations. The pink column then is the outputs and the activities. These are not the research activities, these are the translation activities. So the activities after you finish the research. So think about purple column, sort of the research process, pre-research process as well. Pink column is end of research process. It can happen throughout as well, but just to simplify it down. So what are outputs and activities? The outputs and the activities are things like journal publications, as an example, or maybe patents and licenses, standards, seminars, community exhibitions, data sets, toolkits, new practices, protocols, new commercial products, anything that you deliver out of your research or your program of work. The next column, which isn't usually in the model, is the user. And the reason that we've done that is because we found that people struggled to kind of go, well, how do I get from I delivered this particular policy brief, or I wrote a guideline, to the outcome of that. And so we thought, easy enough, let's put in the user who used, adopted, or adapted your output or absorbed the activity that you did. Now, just before I sort of talk through this a bit further, I want you to think though, and remember that these next users of your work may well be people who help co-create it. So they could be involved in the purple column. And I would also hope that they were involved in creating what those outputs and activities look like, because they need to be relevant to those users. You're not going to give a policymaker and a parent the same type of information. So working with those next users around what's that information look like. So in terms of our column here, we say next user. The reason again for that is I'm trying to make it simpler for you. So you don't have to think all the time around what's happening at the end, 5, 10, 15 years from now, but what's happening next, and then next, and then next. And it helps you build a pathway to that impact as well. So who is going to be that consumer of your outputs and activities? Is it government? Is it policy? Is it community organisation? Is it other researchers, other disciplines, professional bodies? The world's your oyster here. So whoever it is that's relevant to you and to the work that you're doing. And then you have the outcomes and early impacts. So that's the change that happens because of the work that you did. So perhaps a user is going to use your protocol to train new users, or they're going to adopt your protocols into their workplace and their practice. Or perhaps your work has led to a change in understanding or behavior, or it's influenced policy change or practice change, or led to the sale of new products. So that green column there, the outcomes, is your early impacts. And I've worked now on around 400 case studies, and I can tell you that 99% of people I work with are in the green column. And that is because it's very, very hard, and it takes a long time to get into this orange impact column. So think about early and longer term impacts is a nice way to sort of think about that. We want the immediate outcomes, because if you get to the green column, it's easier to get to the orange column if you want to think about it that way. So you need to think about both. Now, the orange impact column is longer term. It could take 5 years, it could take 10 years, it could take 15 years. It might not ever be something you can measure or go back to, but hopefully you can, and we need to think about what would it look like. So that can be what's happened because of a new policy, what's happened because they've embedded your work in the guideline. So you can see how it gets really distal from you, and you might say, well, how do I know if it's my impact anymore? There is an issue of attribution. So it's really about talking through the picture of how your work informed a policy, and how since the policy changed, there's been something else, they've identified reduction in smoking, or an improvement in quality of life, and so on. You're not saying my work caused that, you're saying my work led to a change in policy, which has then gone on to have this effect. So you can see how that's quite a long tail. It can be a bit hard to capture, and I'll give you some tips on that as well. So this is our simplified model. And with this model, you can use this prospectively. So say you're saying, what's my intended impact? Or you can use it retrospectively to say, what impact did I have? So you've got the purple, things that enabled your research or that will enable your research. The pink, what you did and delivered, or what you plan to do and deliver, who you delivered it to or who you will deliver it to. Then you've got the outcome. So the uptake and adoption or use of your output. And the impacts being the consequence of someone using your output. What's that consequence of someone using it? Now, I said I'd give you a little tip here. So the trick here is, if you are working with the next user, the thing that you can do is when you hand off or share that knowledge with them and they say, yes, we're going to take your new protocol or your new practice and we're going to embed that in our organization, you ask 2 questions. The first question is, what do you think will change because you do this? And they might say, well, we're expecting this change, this change, this change, because this is what you told us. That is your indicator of impact. What they've just told you they're expecting. That's something you might think about as a measurement. The second question that you ask them is, how will you know that happened? What plans do you have to evaluate or measure that? Now, most organizations are not going to adopt something without having a plan to evaluate it. Or if they don't, you will be planting the seed for them to do it. And they might say, we do a standard evaluation every 6 months, in which case you say, great, can I circle back and get that from you? So you have the impact information. You're asking them to capture their own impact so that you can go back and just get it from them rather than having to chase it down yourself. Anyway, no more time to go into that one, but that's just a bit of a tip for you. So here's some definitions. I'm happy to share these slides afterwards, by the way. So an output, that's the deliverable that you have out of your work. It's going to be different for different audiences and for different types of research. Activities, I'm talking about translation activities, so the things that you do to disseminate, collaborate, consult, to translate that work with different stakeholders so they can adopt it or take it on board. And the outcomes, the anticipated changes, if you're looking prospectively, that occur from someone using that particular research output, so that adoption of that. A couple of ideas around impact outputs and activities. What do these look like? There can be all sorts of things. So I just wanted to give you a bit of a list to kind of have that. It might be that you're doing some work through media and social media. Remember, that'll be reach. So some of these outputs and activities are going to get you to reach, and others are going to get more tangible things that people can use. So you might deliver an app or an online tool or a digital resource. Perhaps you've collaborated with people, or you've provided some training or some skills development, a spin-out company. Maybe you've developed an infographic that someone's going to use, or a guideline that you published that's going to change practice, or a new clinical tool that someone can adopt. I've seen training programs and MOOCs as well, a massive open online course. For those of you that don't know what a MOOC is, some people have put their knowledge into a MOOC that's then been done by a lot of people around the world. So a lot of people have registered and undertaken that course, and they're able to show some reach. And if they get feedback from that, they're then able to use those sort of testimonials. So some questions you can ask yourself to consider. Activities might be, what do those activities contribute? What did they contribute? So this is retrospective in the black, prospective in the green for you. So what did the activities contribute to achieving impact, or what will they contribute? So asking yourself these questions when you're planning those activities. Who was engaged or benefited, or who will benefit, and who should I engage? What changed or happened, or what are you expecting to happen? What's the potential to happen out of this? And then how did you collect evidence, or how might you collect evidence if you're doing this prospectively? Just so you can think through, how am I going to know the impact of this activity, and be really savvy about how you might do that. So as I said, I use this map all the time. I love the map. So wanted to give you just to say, do this for your own work. Start to say, what are my outputs and activities either going to be or were, depending on whether you're doing it prospectively or retrospectively. Who might those users be? What were the outcomes, or what are the potentials? And then what's that potential benefit or impact? And you can use this for ARC grants, for NHMRC grants. You can use this to map out when you're writing for promotions and tenure. You can use it for writing reports for different organizations to showcase that impact that you've had. So always thinking through, how can I map it out before I start writing? Because once you start writing, it's very hard to kind of unwind it and make sense of it. It's easier to get it on paper first. So I've just given some examples here of what that might look like when you start to map it out. And I could talk about that all day as well. Okay, just mindful of the time. So indicators of impact, what do I mean? So we look at indicators of reach and of impact, and these are the quantitative or qualitative factors that provide that means to measure the achievement or the change, or to track that progress. So it's things like, how many new jobs were created, or what was a dollar increase in revenue, or what was a customer satisfaction rating. There's different types of indicators for different types of impact, but thinking through what shows. So remember, we talked about significance. So what's the significance? Well, the significance is that it created 100 new jobs, or it increased revenue by $100,000, or the significance was that we saw customer satisfaction increase by however much. So you can think about those indicators which show that significance of your impact. A couple of examples for you that I've done, and I wanted just to talk through. So a mapped example of the impact logic model. Those of you who've met me before know that in my spare time, I'm a little crazy and I love to reverse engineer case studies from national assessments to showcase what it looks like when you put it into a model. So if we were to put this particular impact case study that was done by Deakin University in the 2018 Engagement and Impact Assessment, and they did some research around an increase that had happened with rapes and beatings between 2006 and 2008, and they designed some studies to look at the effects of alcohol and violence in the evenings and how to reduce it. Out of that study, the outputs and activities were evidence. They had this evidence that shutting venues earlier and restricting late night sales of alcohol would have was going to be beneficial to reducing rapes and beatings. So they provided this evidence from their research. The evidence was then used by the Foundation for Alcohol Research and Education Last Drinks Coalition, which was a combined police, ambulances, nurses and government union. And they used it to advocate for and to highlight the ineffectiveness of current measures. And it also was used as a way to change legislation that required bars, pubs and clubs in Sydney's central business district to introduce the lockouts that you may well have heard of. And based on those lockouts and the introduction of that, they then went back and talked to the police and to hospitals, and could see that over time, sexual assaults in King's Cross had reduced by 21%, assaults causing grievous bodily harm down 43%, actual bodily harm down 50%. So you can see these indicators of what has changed. And they could also see that there'd been a 24.8% reduction in serious injury admissions during known periods of high alcohol consumption into the hospitals. It was also adopted by the Queensland government and put into their Liquor Act. They had seen that there'd been a downward trend in their assaults there too. And that was obviously a later thing that was happening, and they still didn't have any harder data on that one when they wrote it. But it's good to see they had already had some really serious data around the impacts that had happened. But this is long term, right? So don't freak out if you're not there yet. It's long term. Most people are in that outcomes column, but if you're getting to the impact column, that's really great as well. For those of you in the knowledge space, just because I know this is something that comes up quite a lot, what's an output in a knowledge impact sense? Well, it could be that you publish a data set, or you publish a new methodology or technique, so a statistical analysis technique, a research design. Perhaps you put your work into a book or a textbook. Maybe you've got a patent, or it's your journal publication, so new evidence. The users being other researchers, other research disciplines, teachers, maybe the education system, business might use your patents. And then the outcomes of that being your data set or your database gets adopted into another research area, or that other disciplines use your procedure in a different way, or are using and adopting your methods into their work. It could be that your work that's published in textbook is being used in courses, or those invitations to contribute to other chapters of books. The value of the companies or use of patents is going to be your outcome. Then you've got things like people using your research, your evidence to move it into trials. As you could just see from that example I gave you around the lockout laws, that was use of someone's evidence. They essentially made recommendations based on their evidence that was used to change that legislation. So you can see how that evidence piece can be really strong as well, in that knowledge, but you can have an impact from other people using your knowledge in research if you're in the NHMRC world. Just one last slide that I wanted to kind of put in here to help you guys think about impact, because as I said, I work with a lot of people who are writing about impact, and these are some key words that we use when we write about impact. So used, adopted, informed, adapted, changed, enhanced, influenced is another one that's not there. These are words, when I read about impact, these are words I'm looking for. And if you don't use words like this, you're not really talking about impact. You're just talking about research typically. So I'm always looking for what changed, how did people use it, who adopted what was enhanced, what was influenced, what was informed from your work. So keep in mind these words, make yourself a list, have them beside you when you're writing about impact, and that will definitely help you to think about that next piece. So that's all from my side for this particular one, and that's my details if anyone wants to stay in touch. But like I said, I want time for you to ask questions and for us to have more of a discussion.
Fabulous. Thank you so much, Tamika, for that. I think everyone would agree that that's absolute gold in there. And yeah, we're very happy to share your slides if you're happy for these guys to make use of that. I stopped writing notes. There was so much in there. I thought I just need the slides. So it was terrific. We are going to open up for questions. I know there's a couple coming through on the chat, and Annalise will get those through shortly. But just encourage you all, if you want to ask a question, flip your video on or put your hand up, and we've got 20 minutes here to really pick Tamika's brain. So while you're all thinking, I really love, Tamika, the way it was so evident the importance of co-creation from the start, and the role of co-creating not just the research, but the activity and the outputs plays in actually achieving your impact. I think that just highlights how important that is for achieving impact. And then the other thing was about, the impact after. The impact is after it's been adopted, adapted, or used. And that just, again, shows me that if we're not thinking about these things at the start, what's the chance of someone just, it used to be you'd publish and then maybe someone will adopt it, adapt it, or use it. But if we start thinking about these things at the front end, we're actually increasing the chance that this may happen. So one question I had for you while everyone's bringing through their questions would be, what do you think is the most common mistake you see researchers making when they're trying to think about impact or communicate impact in a grant, or maybe something that we just overlook all the time and you think, oh, if only they'd done this? What's the biggest thing?
Oh, there's so many. Let me, I don't know if it's the biggest thing. One of the most common mistakes, I guess, that people make is thinking that impact is the findings of their research, and missing that piece of someone actually taking it. The use by others, I think, is the big one for me. Like I always say, who else used it? And they're like, oh, well, we used it in another grant. And I'm like, oh, that's not impact. So always thinking about that, who else? And I think that's a really big one that I see quite often. The other one that I see a lot is the context piece. And it's like you said at the beginning, where you said understanding the problem, but not just understanding the problem, but being able to articulate the problem to others. And so setting that context for people who are going to read your work, or for people that you're talking to, because I see that we make a lot of assumptions, all of us are guilty of that, by thinking that the person we're writing it for or we're communicating with knows what's in our head, when really we actually have to go back to that basics and sort of take someone on that journey with us, because they're not going to know it. And I see a bit of that assumption coming through when I read people's stuff on impact.
It's actually an easy trap to fall into, isn't it? You think everybody understands it, but then you go back and they go, but what do you mean by that? I see one of the questions actually that we'll go to later is, what do we mean by implementation science? But we'll save that for a bit later, because that's a big question. Philippa, I can see your video on. Did you have a question you wanted to ask?
Yes, I did. So I work across the hospital sector and the research sector. And there seems to be a gulf between what we call impact and what we call practice improvement. Are they different? If so, why are they different?
Yes, I guess, Philippa, it's really interesting because, you know, you have some of the research, which is very iterative and it's about the process change. And so I'd ask you then, what's research versus what's use of that research? So if the research is about doing research on getting that practice change going on in the hospital, then it's research because you're still testing. Impact will be if it's sustained after the research has found what it's found, and if it's scaled to other universities or other hospitals or other groups that could use that information. So it is crossing over. I think sometimes that work is the most valuable in terms of the easiest to create an impact because it's being done right there on the ground with the people who ultimately will use it. But I've also seen some issues sometimes with sustainability because while it's research and it's probably being paid for and supported, people are happy to do it. But what happens when you step away and they're kind of left to do it on their own? Is it sustainable? Have they built the skills to do it? Have they put in place any of the funding to keep it going? All those types of things. So I'm always still thinking after, even though that way of working probably sits a little bit in the outputs column, if you like, in terms of that style of research being an activity or an output in itself. Does that make sense, Philippa?
Yes, I guess there's my personal view is that there's a little bit of an unnecessary gulf between the two. So I guess I'm really hoping that the two things will come together. And if you had any more comments on how you actually do that, just seems we've got a bit of a divide in perception between
the researcher and the hospital workers, you mean? Or
yeah, depending on who initiates it and who translates it, I guess.
Yeah, and I guess that's where it needs to be like a team effort. But again, I mean, I think that gulf is overcome by kind of working out where the decision makers are around that sustainability of it after you step away, having those honest conversations around the practicalities and the cost of continuing to do a service in a particular way. It's something that, you know, we get trials funded, but when you ask people, well, do you have a commitment to continue this after if it's successful, and they kind of go, oh, we never thought about that. That's where some of those can come for sure.
Yeah, thank you.
No worries.
Tamika, we've got one that's come through online from Veronica. You've got lots of comments thanking you for all your resources, by the way. But Tamika, what's your perception of recency of the research we shall be using or applying in grants, i.e. how old is really old? So is that around the age of research? Veronica, you might need to jump on and give some clarification there. Thanks, Veronica.
Hi, Tamika.
Hi,
Thank you. Thanks. Thanks for your presentation. I'm just wondering because we see a lot of research used in the grants that may be quite obsolete, or maybe sort of the recency of the research may be a couple of 10, 20 years old. So in your opinion, just if you can give us an advice on how old should be really old, you know, what you're looking at, or what do you think that we should sort of have as a boundary?
So in national assessments, they usually give you a period that the research had to happen within and the research impact had to have been realised in. But if you're thinking about something like an NHMRC grant, as an example, they have a line that says, although the program of work can be from any time in a researcher's career, the impact is expected to be recent. And a lot of people have confused that with the research is expected to be recent, not the impact is expected to be recent. And as we know, impact takes a long time. So the way that I have interpreted that and been working with people is to say, use your program from whenever it is, and that doesn't matter if it's 2008, if it's 2010, whatever it might be. But what we want to see is that Not just that you published and did something in 2008 that was used for 2 years and was great and no longer exists. What we want to see is that you've had sustained and continued impact. And there's a couple of ways you can do that. If your work is still being adopted into policies, or it continues to be used in renewed policies and guidelines, then that is continued impact. If you can, in a knowledge sense, you can outline what percentage of your citations have happened in the last couple of years, as opposed to an article that was published in 2010 that might have had 200 citations but none in the last 5 years, kind of thing, which means it's not continuing to have impact. So I would say in terms of the age of the research, I don't think that's as big an issue as whether or not the impact is continuing or whether or not it's been sustained. And that, again, comes because it does take a long time. I've worked with a few people, though, who've been very fortunate to work on things that are very timely. And say, for example, they've done their PhD, 4 years of research, and it's basically been put into policy because it was done at the right time. It just happened to be that it was delivered just at the right time, and bonus for them, but that doesn't happen very often. So hopefully that helps, Veronica.
It does. Thank you so much.
No worries.
Annalise, do you have one?
Yeah, Tamika, we've got a question from Joe Nolan online, and just interested in your experience of what researchers are sort of generally doing to learn about what's important to health services. I think it brings us back to that question around the sort of co-creation and the design, and finding out from your users to be what's important to them in terms of planning your impact. So yeah, Joe's just wondering, in your experience, what are researchers doing to learn what the health services are looking for?
Sometimes not enough, Joe, to be honest, and that's being brutally honest, not being critical, because I realise that it can be really awkward, it can take time. Look, talking to stakeholders and building relationships takes a lot of work and it takes a lot of time. So when we work in this space, we make an assumption that everyone that's doing really good impact has got these great relationships and they can work with people. And I appreciate that's not always easy for everyone. But ultimately, it is about building your network. It's about having people that you can go and ask. And the people who are successful are going out and creating those relationships with the people in the practice area or in the hospitals or the service provision, to start having those conversations, to start saying, what's important to you. And importantly, they're not just doing it when they need something. They're checking in with these people. They're part of their network. It's part of the work they do. It's not just a one-off thing. If you build good relationships with people, you don't need to check in all the time, because I know that when you do, that it's of value to them. So you kind of got to build those relationships. That's the core part of it, really. It is hard. I get that. But I think just be brave as well. That's my biggest piece of advice with this. Be brave. Be open to just having lots of coffees with people, learning from them, and not having any expectation in return. Any thoughts on that as well, Joe?
Oh, hi. I'm just worked out how to get off mute. Thank you. I was just wanting to ask, from the perspective of understanding health services needs, do you think there's more that universities could do to support researchers to understand what health services need?
Yeah, I mean, it can go both ways, because understanding what they need is great, but having an avenue into the health service to actually affect change is another piece. So, I've seen some groups actually do research on what are the gaps, what's the needs, and they've done that needs analysis piece as a piece of research. And then they can say, okay, let's do research on different things. But it may be then you need to circle back and say, okay, we did the needs analysis. What's needed now? Or what are you willing to invest in now? And not meaning they need to fund the research, but meaning, should we be successful, what level of preparedness do you have to implement what it is that we're finding, or our suggestions or our recommendations? What new skills need to be built in order to do that? So I still think, even though universities can support and be helpful in that respect, I still think it comes down to a relationship on the ground level between the research team and the people that you're trying to work with to embed those changes.
What about things like, have you seen successful co-funded positions at professorial level, or are there any structures between universities and health services in different settings that really accelerate that?
Yeah, look, I think the things that I have seen are like clinical researchers. So when you've got a clinician who's a researcher who sits in the clinic, then you've got more probably more crossover and it's more successful. But I've still seen issues with that occasionally, where it's something that gets embedded in that hospital but never rolled out to any other hospital, or just gets used by that one or two clinicians who do the research kind of thing. I haven't seen any other structures. I'm sure there are some around. Again, it would be great if there were people within your organisation who would provide that avenue. And it may be that someone else on the call knows of some of those as well. I mean, we've got a bit of a brains trust here. So if there's anyone here who does know of that, I mean, please.
Well, I think also that's where your translation centres do come in. We are a conduit to health services. So we have health services coming to us all the time with different needs. And then we know what different researchers are doing, or we can ask what researchers are experts in the field that can contribute to that. So I'd say definitely, you know, everybody should be linking in with their translation centres in some way, or staying abreast of the opportunities there. But I would say, Tamika, I absolutely agree with you. The best structure, and I know we do need some structures and some avenues in, there's nothing, no substitute for the hard legwork of actually building relationships with people on the ground. So that could be policy workers, it could be health administrative staff, the actual clinical staff. The stronger those relationships are, the better chance we have of actually delivering impact. But I had a question for you, Tamika, around, you know, you mentioned, you know, you ask people 2 questions and whether you can loop back in so that you can track your impact. I'm really mindful we've got lots of researchers on the line here, and I know they're supremely busy writing grants and doing the work. Have you come across any way or any tips on how to keep track of your impact? Because some of it just launches and it goes out and it's kind of got a life of its own. Do you have, and other people on the call may have some suggestions here on how an easy way to keep track of their impact so they can use it?
Yeah, so there's a wealth of tools that people will try and sell you to keep track of your impact, for sure. And look, that can work for some people. At its simplest point, I really think circling back with any particular stakeholders that you might have worked with who could potentially have taken on your work and used it, and asking them, you know, has anything come out of that? What's gone on? Is there anything more you need from me to help you? Is there, you know, so you can help to accelerate that as well. So that's one way of doing it. I say to people that I work with, put a time in your diary every couple of months. Can you go and say, what's my impact been from some work I've done before? Think about it as a whole other piece of your CV and keep track of it in that way. What have I delivered? What's come out, you know? And for those really tangible outputs, it might be, you know, well, we did publish a toolkit, or we did publish a new method or a technique, or we did publish our data. Let's go check out who's used that. Let's get some reach measures. Let's get some use measures of that. Let's see if we need to look up anything else or reach out to anyone. This is becoming a massive part of not only funding, but promotions. And, you know, if you do any work with philanthropy as well, reporting, it's becoming a huge part of everything. So think about it as a whole other part of that CV to do that. It's not always easy, but again, think about who's the likely user, who possibly used this work or who had an interest in it, and then just circle back to those groups that you perhaps shared your work with, or who used that work. If you're in a really fundamental knowledge space, you're going to use tools like Altmetric, or you're going to use tools like SciVal or Scopus, things like Overton that will help you to understand whether your work's been taken up into policy, or whether your work's had any media, and those types of things that you can find through using other tools that are available.
Fabulous, thank you. And I can see that Cheyenne has popped in the chat a link to an impact CV. So if anyone is, you know, at the starting point and you need to develop one of those, thanks for that, Cheyenne. That's a great tip. Look, Tamika, I think that's the end of our questions. If anyone does have questions that you would like us to put to Tamika, feel free to email them through and we can connect you up with Tamika. Tamika does run lots of training courses and we generally promote all of them, I think, Tamika. So keep an eye on our social media and our website for those. I'd really encourage you to get along to any of the training courses there. It's money very well spent and probably would give you a very big return in your research and your grant applications as well. So thank you so much, Tamika. Fabulous to have you here, and thanks for sharing your tips. We will be back again next week for our session number 2 on research impact. So spread the word and feel free to join us then when we look forward to seeing you all next week. Thank you so much. We'll see you soon.